As we continue to monitor the devastation in Los Angeles regarding the wildfires, symptoms of prolonged stress, hypervigilance, and sleep deprivation affect you both physically and psychologically. But what happens to the heart during traumatic events? And is there anything we can do to mitigate the potential to cause heart problems?
Here to talk about all of how trauma affects our heart is our medical expert again, Dr. Payal Kohli. Thank you for being here, of course. And again, first of all, when people react to a situation like what folks are going through in Los Angeles, I mean, you can see a visceral, physical response to that.
It's crazy. And as a cardiologist, I feel like, PTSD or these kind of emotional responses, they're not just in our head, they're in our body because we see effects on stress hormones, adrenaline, cortisol. These surge, causes your blood vessels to constrict, causes your heart rate to go up. It can even cause chronic inflammation. And in the long term, you can imagine it's not just the physical effects, but when we're stressed, we eat poorly, we sleep poorly, we drink more alcohol, we don't exercise. And so it really is a domino effect where these types of events can cause effects for decades to come.
And that's what's concerning because, the situation in Los Angeles, people are on high alert every single night, all hours of the day. And the texts that I've received from some of my friends, I can feel the anxiety through the phone. So is there PTSD that you feel is going to come from this? And how does PTSD affect your heart?
Yeah, I mean, I feel the anxiety and I'm hundreds of miles away. And so PTSD or post-traumatic stress disorder, we think it has to be some significant, specific event. But natural disasters, the idea of losing your home, the idea of evacuating your home, any of the things that our community members in Los Angeles are going through can really cause this PTSD phenomena, which is, again, mental, but it's also physical, psychological, and emotional. And once somebody has PTSD, it becomes a chronic disorder. It's not something that ever gets cured or goes away. It's sort of like a scar that you carry with you emotionally that can cause physical effects for many years to come.
I've heard about this, but I'm curious to have you kind of break it down here. What is broken heart syndrome?
I see this all the time as a cardiologist.
Really?
So it is an intense psychological or physical stress, so a natural disaster, a divorce, a death in the family, or even something like a car accident that causes a surge of stress hormones in your body, which can then paralyze your heart. So think about what the heart does. It's a pump that pumps blood. And so Takotsubo's cardiomyopathy or broken heart syndrome is the stress hormones causing a paralysis of the bottom half of the heart, which is essentially heart failure. Some people can end up in the intensive care unit with shock, and thankfully people recover pretty well from this condition. But it just tells us how closely our heart and our minds are connected, and how a condition like this, a natural disaster, can certainly trigger something like broken heart syndrome.
So, Dr. Kohli, what can people do, whether it's the folks in Los Angeles or, we've had our own fair share of wildfires here. What can people do in those moments to protect their heart health?
I think you have to do something. You have to acknowledge that your stress levels are turned up, you're amped up, and you have to practice diffusion strategies. So this is mindfulness, this is meditation. This is something called cognitive behavioral therapy, where you're actually kind of talking back to your brain to diffuse those stress hormones. Because what happens is we get caught into this feed-forward cycle where we feel the stress and then we worry about our home, we worry about our kids, our family, and then we worry about our health with all the wildfire smoke, and that creates more stress. So that kind of talking back to yourself and then recognizing in the long term that if it's becoming persistent, because you're turning to the bottle or you're feeling like you're not functioning the way that you used to before, you haven't rebounded, then it actually needs to be addressed on a bigger level, whether that means from a psychiatrist or with medications. But if you don't address it, you really are asking for a whole host of problems many years later.
I feel like people aren't talking about this.
No, and advocating for yourself. Like you have to be the front line of defense, right? Your doctor doesn't know unless you tell them what you're going through.
You have to ask for help. And I think what we can do, as you've been saying, Sam and Alex, is call our friends and family members who are in LA or anyone who might be coping with something like this and check in. Because being attuned to what somebody else is feeling, and sometimes you don't even see the change in your behavior, it's your loved ones around you that say that you're hypervigilant, you're more stressed, you're more irritable, you're not sleeping well, you're not behaving normally. They're the ones who help you identify that PTSD phenomena is developing inside of you.
Dr. Kohli, thank you.